Hi, this is the session for antiarrhythmic drugs. This is session 4. Dr. Ahmed Nawaz Khan from School of Pharmacy, Graphic University, Dehradun. In the previous session, we have discussed about the class of the antiarrhythmic drugs. Specifically, we discussed about the class 1B that was comprises of the lidocaine, phenytoin, lorcanite plus the loratadine. Now, today we are going to discuss the class 1C. So before we move, we should just, as I recall, we should understand that the 1A, the classification of the antiarrhythmic drugs are of four types. The class 1, 2, 3 and 4. The class 1 is further divided into class 1A, 1B and 1C. If you remember that this class 1A belongs the drug belongs to this class 1A was the quinidine, procainamide and disopyramide. And we have also covered the dipyramide synthesis. These they actually talk about the mechanism of action. They lengthen the period of the impulses. 1B, the drug of this class 1B is the phenytoin and mexiletine. They shorten the duration of action potential. Now the next comes to the 1C. So we have in our syllabus we have one drug which is Lorcanite. There are other drugs in this class 1C, the Ancanite, Flecainide and the Lorcanite. These drugs they slow the conduction system of the heart. Discuss something about the Lorcanite. These morphine, they are the most potent sodium channel blocking agents of this class 1 antiarrhythmic drugs. They are the most. So now the Lorcanite, which is one of the most potent sodium channel blocking agent. Now this compound basically it belongs to a class of the organics are known as the phenylacetamides, and these amide are the amide derivatives of phenyl acid. We can say that the class is the superclass on is benzenoids, the subclass is phenylacetamide. Okay, now the next class of the antiarrhythmic drug is the class 2 drug. So these are basically the beta adrenergic blocking agents, and what they do, they stabilize the membrane, or they depress the on the they having the depressing effect on the myocardial tissue. And how they stabilize, or they having the depressing effect on the myocardial tissue? Because they principally what they do, they reduce the slope of the phase 4, right? And this example of this beta adrenergic blockage is one of the prominent examples is the Propanolol. So now let's have us discuss a little bit about the Propanolol. Yes, this is the structure of the Propanolol, and this is the structure of the Propanolol, which actually this is a racemic mixture of two enantiomers, the S enantiomers, and this enantiomer is having 100 times the binding affinity for beta adrenergic blockers. So this propanolol is having used to treat a number of conditions, but all of you know that this is most commonly used for the hypertension. It is used as antihypertensive drug. So it also has the antiarrhythmic properties. Okay, so now if we see the structure of this propanolol, so this is a compound which belongs to the naphthalene class. So naphthalene moiety, actually this is the two-fused benzene ring. This is the naphthalenes. And if we say the superclass is the benzene class is basically naphthalene. An overall structure, it is a homopolycyclic compound. So this propanolol, when propanolol, the alcohol is avoided. Alcohol increases the plasma concentration. Now toxicity of this propanolol. So the symptoms of the overdose of this propanolol include the hypotension, even hypoglycemic seizures, some restlessness, euphoria, and so on. And sometimes some patients develop the bronchospasm due to the overdose of this propanolol. Now the next class of the antiarrhythmic drugs is class 3. So drug in this class, just like example Amiodarone and beryllium, Sotalol, dofetilidine. There are several drugs in this category. They are having the different physiological changes on the myocardial tissue. They have very one common effect, which is the action potential. Their electrophysiological changes on the myocardium are different, but they have all these drugs, Amiodarone, beryllium, Sotalol, they have one thing which is called prolonging the action potential. This action potential result in increases the effective refractory of the membrane action potential without changing in the phase of depolarization or the resting membrane potential. So drugs in class produce their effect by more than one mechanism. We can say that by more than one mechanism they show their action. Like Sotalol, which is a potassium channel blocker and has beta adrenergic blocking properties also. Amiodarone and the beryllium drugs are that prolongs the action potential by means which are actually not which are unclear, but they have showing their sodium channel blocking properties. Very true that these drugs, they having the number of mechanisms through which they can act. Now let's discuss one by one. Now, drug is Amiodarone. This is the IUPAC name of this Amiodarone, which is firstly it was introduced as an anti-anginal agent. And it is very pronounced, very dominant of this class, especially because if it is very effective in maintaining the sinus rhythm in patients who are treated by direct current shock for arterial fibrillation. So this is very important drug in the class 3. There is some adverse effect also of this drug, but they cause different action on the different organ systems. It also inhibits the metabolism of the drug, which is cleared by oxidative microsomal enzymes. This drug contains protein in its molecular structure, Amiodarone, and as a result, it has an effect on thyroid hormone. This point is very important, and that's why the hypothyroidism occurs in many of the patients. Around 10 to 12% patients, they may develop the hypothyroidism because of Now, if you see the structure, this drug belongs to a class of organic compounds which are aryl phenyl ketones. These aryl phenyl ketones are the aromatic compounds which contain the ketone substituted by one aryl group and a phenyl group. Now, these amiodarone, the classic, oxygen compounds basically, and direct compound, they are the aryl phenyl ketones. Overall, we can say this is an aromatic heteropolycyclic compound. Now, if we talk about this, the food interaction of the amiodarone, so we should avoid the grapefruit products, because this grapefruit, as earlier we have also discussed, that these fruit, they inhibit the cytochrome P3A4 metabolism, and that's why it increases, or it may increase, the serum concentration of the amiodarone. We take the amiodarone with the food or without food, and because the absorption is unaffected by food. Now, the next is sotalol. This sotalol is a methane sulfonamide which was developed in 1960. It was the class third antiarrhythmic drug, approved as a pill in around thereafter. It comes into the form of the intravenous. This drug is used treating ventricular arrhythmias and maintaining the sinus rhythm in the arterial. So when we see the structure of this sotalol, it belongs to a class of organic compound which are sulfanylides. That means the organic aromatic compound containing the sulfanylide moiety with the general structure of the which contain the carbon-carbon double bond with the double bond with the cyanide, etc. So basically, the superclass is benzenoid and the subclass is sulfanylides. Sotalol inhibit the beta-1 adenosine receptor in the myocardium, and it also inhibit the potassium channels, rapid potassium channel, to slow the repolarization. It's also slow and shorten the conduction of action potential through the arteria. Overdose of the sotalol cause the bradycardia, congestive heart, hypotension, and also hypo. The antiarrhythmic drugs. So we have discussed number of antiarrhythmic drugs: class 1, class 2, class 3, and class 4. I just forget one very important property of this sotalol. This sotalol, it's having an enantiomer, and the enantiomer are two: the plus, which is the D form, and the L form. The L form, that enantiomer of the sotalol, has the beta blocking, that is the class 2, ability, and the potassium channel blocking, which is itself the class 3rd activity. While the D form, which is the plus enantiomer, has the only class 3rd property, but the affinity towards the beta adrenergic receptor is 30 to 60 times. 30 to 60 times lower than the. So this sotalol having the L enantiomer and the D enantiomer. The L having both the beta blocking as well as the potassium, while the D having more affinity towards the receptor, which is around 32 slower. And it is D form has on third property, channel blocking agents. And this beta adrenergic receptor of this sotalol, because of the enantiomer, is it distinguish this amiodarone on the other like dratyllium, distinguish the sotalol from other class 3 drugs because of this beta adrenergic receptor blocking action. Class is the class 4 antiarrhythmics, and this is like the example are the verapamil and diltiazem. These are verapamil and the diltiazem, they slow inward of the calcium ions, which is basically the calcium ion currents, which are the voltage sensitive channels in the cardiac fibers. So these slow down the AV conduction at atrioventricular conduction and the sinus rate. So these are the two drugs of this class, verapamil and diltiazem.